Welcome to this fourth panel of this celebration of Sangath's 25 years of mental health action. I think we've heard a lot actually over the last few hours about the topic of this particular panel. And I'm going to actually maybe stray a little bit from the script occasionally for my wonderful panelists, all of whom have had tremendous experience of speaking extempore, improvise. So because actually we've heard so much about the subject of activism, the role of civil society, non-profit organizations, and I'm extremely conscious that actually this is a terrifically diverse panel of individuals who represent quite different sectors. And so perhaps I'm going to actually delve a little bit deeper into each of those sectors and ask each of you about the roles that your sectors and your own personal experiences, and I'm hoping we are going to delve into our own personal experiences on how we can achieve a rights-based approach to mental health in India. I think rights-based approaches have been spoken a lot about. In my own perspective, rights-based approaches include rights, for example, for individuals to be protected from harms to their mental health, such as gender-based violence or child maltreatment, but also the rights for people with mental illness themselves to be protected from violence and discrimination. Another kind of right that I think is equally important is a right for people to have access to the care that they choose, that they prefer, and that is of adequate quality. And with both of these rights, there are many other kinds of entitlements that people in our country are entitled to, thanks not the least due to the Mental Health Care Act that we also heard about in earlier sessions. So I want to welcome this fantastic panel. We have a fifth member who has unfortunately had a flood in her locality in Chennai. As I'm sure all of us are aware, there has been a terrible climate event that has been going on in the last few days in Chennai, and Dr. Thara is currently without any electricity. I'm hoping first of all that she is well, but also that power return and she may be able to join us. But nonetheless, we have four terrific panelists with us. And what I'm really going to do is do a brief introduction of each panelist. One of them, of course, has already been with us in the previous hour, but still, I will introduce you as well, Sadam, and then ask you questions. And I'm hoping very much that this will be an interactive panel, that we will have also the panelists asking each other questions. So here is we don't need any slides. I think I can just speak to a brief introduction, and you can put all the longer bios in the chat. So let me kickstart this panel by inviting our first panelist, Sarbani Das Roy. Sarbani is a real crusader in the area of development and mental health. As we heard, she follows also from the last panel of another crusading organization working in areas that overlap with hers. She is associated with Ishwar Sankalpa, an NGO, not-for-profit in West Bengal. She's really pioneered an alternative pathway for the care of homeless persons with mental health problems, which has reached over 3,000 individuals, established the first shelter for homeless women and men with psychosocial disabilities in Kolkata in collaboration with the government in West Bengal, and a lot of other things that you can read about in the chat. So I really wanted to start with you, Sarbani. You work with one of the most vulnerable populations. We've heard a lot from Rinalini and others going before us about vulnerabilities of various kinds, gender, living on the streets, caste, and so on. And I guess these converge a great deal when you're working with homeless people. And I wanted to hear your personal experience of Ishwar Sankalpa. How did you actually address the structural barriers? What forms of activism did you engage in order to get to where you are today? What are the lessons that you can share with the rest of us? Sarbani, you're muted.
As I begin, I would like to first pay my respects to an organization who in the last 25 years has been a towering lighthouse in the mental health space. And in this journey, you have actually helped us, many activists, the arsenal to raise our voices. And as we celebrate this day, let me attempt to say a few words of the challenges which have come together as a collective to gather momentum in the ways that we have tried to bring about change. When I talk about my own personal experience, Vikram, Ishwar Sankalpa started with one of the most challenging constituencies, the homeless people with psychosocial disability. We started at a point when one is we did not have any money to start any shelters or any such institutions. So we started on the street and we tried to find out who was responsible for these people. That was the first point. That was the first question we had. And we first went to the social welfare department and we said that these are the homeless people with psychosocial disability and we need your help. So they said, see, because they are homeless, they are our responsibility. But because they have mental health issues, you have to go to the health department. So we went to the health department and then the minister said, yes, I'm very sorry to hear about the condition of these people. But you see, because they are homeless, we cannot do anything about it because the entire institution of the healthcare system depends on the institution of the family. If a person can't say who their father is, what their address is, I'm sorry, we can't admit them into a hospital. So who's going to take their charge? So we found ourselves in nowhere land. We were with the last persons on the street. They neither belonged to the social welfare, neither did they belong to the health department. So who were there? Where did they belong? And finally, it was just by a stroke of luck. There was this one line in the 1987 Mental Health Act, which said that the police commissioner is the guardian of homeless persons with mental illness. It was with that one line, I went to meet the police commissioner in Kolkata and I said, sir, you have to do something about this issue which I have. So he said, why should I? He said, I have many other things to do. I mean, why are you coming to me with this problem? I mean, go somewhere else. I said, sir, because the act says that you are the guardian. And then he, for the first time in his life, I think he took the Mental Health Act in his hand and I pointed out the line and he read it. And then he looked at me with very sad eyes. I still remember that look. And he said, what do you want? And that was the beginning of the story. And I found that it was this one single act which could actually be leveraged to bring about some change in the conditions of people, because I had finally found a guardian for these people. So that was my personal experience with activism, which started on that day, Vikram. Now, if I just look at the overall scenario of activism and mental health, I would like to say that we are going through a crisis of anger. In my early days, I had read about the crisis of faith by Radhakrishnan. Now we are going through a crisis of anger. In the sense, our tolerance of mediocrity, corruption, harassment has been rising over decades. And we are not reaching the tipping point for people to come together in a spontaneous process. Whether it is for the 1% of healthcare budget for mental health or the new legislation, which has remained just an announcement of official support to mental health care rather than a commitment to it. The tipping point of anger has not yet arisen, and the responsibility now falls on civil society. And this is which by itself also has certain challenges as a group. Now I will talk about myself because this is what I have experienced also in this entire journey of walking with civil society organizations, trying to form collectives, trying to see a bigger picture. Do we walk our talk? For if civil society organizations are proactive, then it has to follow that they will take steps to ensure inclusion in their own ranks. Passionately fighting for rights on the outside does not necessarily mean that these same organizations are practicing inclusion and equity on the inside. The jarring facts, when we look inside CSOs, we often see the same exclusions and inequities play out in the way CSOs are structured, the way decisions are made, resources are allocated, and the ways in which silences and abuses of power are maintained. If we truly wish to innovate and disrupt society for the better, we must be prepared to disrupt the power within our own organizations. We need to ensure that we align the mandate and principles of civil society with its practice. This has been one of my, the arms that I carry while I've been working with civil society organizations to form a collective. Secondly, I see that there is a difference between debate and deliberative dialogue. During the drafting of the mental health care bill, as Soumitra was talking in the last panel, there was sufficient time and space given for consultation in civil society. And yet we have seen that the discussion tended to be one of debate, where one argument won and the other lost. This has been an extremely sad affair. Complex public issues like mental health cannot be addressed through binary dualistic thinking that assumes one right answer to the whole problem. For example, recovery is not about replacing medical treatment and medication with social services and peer support. Rather, recovery seeks to promote people's ability to choose and to ensure that options are available to meet the full range of people's needs. That is something which many groups have not been able to see eye to eye. Thirdly, we see one of the greatest challenges of civil society activism has been the threats. The threats of activists who challenge are that they also face charges of criminalization and stigmatization. Very recently, we have seen one of our human rights activists, in which keep happening this through public discourses, media, IT raids, and other known ways. We have to build counter narratives that promote the important contribution that activists make to democracy. We need to work in alliances that create a stronger voice and mitigate the risk of speaking out. Fourthly, donor resources. Donor resources have been essential for developing and strengthening movements. And we can see that because of the changing donor priorities, things are getting difficult to get funding for civil society activism. The share of this shrinking pie is another block, another challenge, which causes CSOs to stay away from each other or compete against each other when they should be actually together. Fifthly, the most important part is the lack of trust and solidarity. Getting civil society together in activism needs time for listening, understanding, and value of each group, and demonstrating the capacity to be responsive to the concerns of each constituency. This in turn establishes trust, which is the main component of activism when it comes to civil society. Lastly, I would like to say that we surely all agree that what Amartya Sen reminded us, that development is freedom. We all agree that development is almost exclusively about access to and the sharing of resources by the society. And we know that this is a highly political process. Then why do CSOs not take up activism? And this is a question I'm asking myself, because even when we believe that development is about power and politics, we tend to focus on development as if it is a social problem only. We raise funds using the stories of persons with mental health conditions whose suffering is a result of a failed political system, not a failed father or mother. We run projects in isolation. We do not connect the dots. For example, when I see a homeless person with mental health issues running naked on the streets of Kolkata, I immediately jump to somehow help the person. I don't connect this scene with a failed budgetary process of government. In that case, am I really committed to my cause? To save this world and the issues that we are confronting in mental health, we must come together to save our spirit of activism. So thank you.
Thank you so much. Those are really powerful words, Sarbani. And I was thinking very much as you were, especially with the very poignant example you gave right at the end. I was thinking of similar examples that we heard from Rinalini from the Banyan. How do you actually manage within the role of civil society organizations, indeed any organization? And I'm going to turn to Prabha in a moment, who works in one of the country's leading government institutions. The sense of powerlessness. Let me be absolutely blunt with you, Sarbani. For those of us who are committed to working at the coalface, as you are, working with individuals and in smaller communities like Sadam is working, the sense of powerlessness is one. And I'm going to come back to this. I'm going to ask you actually, how do you address that sense of powerlessness, particularly in the context of the fragmentation, the lack of solidarity, and the breakdown of trust? And here I'm talking about solidarity and trust, not only between the community and the political system, but also within the community, the fragmentation that is occurring actually has been around for a long time, but it's just become more amplified, I believe, in recent years. So I'm going to come back to you and indeed to others. How can activism address the fundamental social, political, structural issues that influence mental health and mental health care, and yet keep focus on the individual in front of you who is having a significant mental health problem? And with that, I want to turn to Prabha. Prabha is one of India's leading psychiatrists, the head of the Department of Psychiatry at the National Institute of Mental Health and Neurosciences in Bengaluru. But Prabha, I know for many, many years as perhaps one of the most important voices on women's mental health in the world today, and widely recognized for her, not only her incredible academic work, but her real unstinted advocacy and activism around women's mental health, covering many, many different issues, including issues like gender-based violence. And I wanted to actually ask you, Prabha, as you have addressed this issue of women's mental health, you're a top clinician, you run these highly specialized clinical facilities in NIMHANS for women with mental health difficulties. How do you be an activist? You recognize as much as any one of us that these mental health problems don't occur in a silo. They are clearly an interaction between women's biological status, but with their social and political environments. How do you deal with this?
Thanks, Vikram, and first of all, congratulations on the 25 years of Sangath. You've been a great, like Sarbani mentioned, a lighthouse, a torchbearer, and probably done the country's most well-designed randomized control trials on community-based interventions, which actually probably academic institutions should have done long back or should still be doing. So hats off to you there. So yeah, how can you be an activist in a government institution? It's very hard. And it's not easy. To just give you an example, a very small example, because I think these very practical examples are what are important. When women come to our service, many of them are just married, separated from their husbands, and do not have enough identity or social security documents. They are not given free treatment because of that, because they don't have a below poverty line. And this has been one of my biggest issues, that women's ration cards, women's cards of poverty line, whatever BPL cards, are all linked either to the mother's family or to their husband's family. And for some reason, if they do not have the cards related to being married, then they do not get free treatment. Many times they have been neglected by their families, and we have to really struggle to get them appropriate treatment. Now, this is such a small thing that can be rectified. Why can't we, ensure that it does not matter that this woman has a card or doesn't have a card? If you have to make a file in NIMHANS, you need an Aadhaar card. If you do not have an Aadhaar card, you cannot make a file. Now, that's, it's all right for a middle-class family, but it's not okay for so many of people who just come, without any documents. They are severely ill. If you find a homeless woman, what do you do with that? So I think these are sort of small examples of how being a woman and being a mentally ill woman in India can be a huge barrier to seeking help, to getting help, and to accessing help. So my concern has been also in this area is that the government is not talking enough to civil societies, not talking enough to activists. There is some sort of a inherent suspicion about that relationship, and I find that very heartbreaking, because I work with so many people in civil societies. All my work, if you look at gender-based violence, it is working with Vimochana, it is working with Sneha, it is working with all these organizations who actually are part of civil society. And to me, the fact that the government institutions do not take take the help, take the knowledge, include civil societies into our discussions, our dialogues, people who can be so helpful to us, because you're on the ground. We are in this big institution, looking very inwards, looking at our papers and looking at our promotions and looking at just, managing these little group of, like you said, clinical sort of load, and not really knowing what's happening out there when the person goes back home or when the person is on the street. We really don't know enough, and there is so much to learn. But for some obscure reason, I find that there is this huge gap. And even if you try to get people from the NGO sector, from civil societies into sort of various groups and committees, it's tokenism. And I know the only person who sort of rectified that was our beloved Dr. Mr. Keshav Desiraju, who ensured that enough people from civil society were included into government structures. But following that, it has not happened, and I think that we are losing out on a great opportunity of helping sort of increase the voice of what we want to do. So the point I'm trying to say is that when people think that, oh, you're a NIMHANS and you can do a lot of things, actually we cannot do a lot of things. Because like Sarbani mentioned, if you're talking about gender-based violence, Ministry of Health and Family Welfare is not interested in gender-based violence. It's the Ministry of Women and Child Development which is interested in, gender-based violence. And so over the COVID pandemic, all I did was literally every other day call the Ministry of Women and Child Development and say, what can we do? What can we do? What can we do? Till the end of 1 year, we got a grant to train all the one-stop center counselors across the country in mental health issues and gender-based violence. But it required a lot of persistence from my side and at a very individual level. It was not an institutional thinking that, oh no, this is happening, let's do something. Let the director go and talk to the minister and say, hey, gender-based violence has a lot of intersections with mental health, let's do something about it. It didn't happen like that. So even within a government institution, there is a need for that very strong activism from those of us who are willing to stick our necks out. I'm going to stop here at this point before I say something more damaging.
No, I don't think anyone is listening in here who doesn't actually agree with you. Actually, but I wanted to just highlight something you said, which is so important. There's this lost opportunity of working between sectors. So much conversation there is about intersectionality, and yet so little genuine action. And I've had the same experience. For example, the Department of Health Services and the Department of Medical Education, many states split the health service delivery and the medical education sector into different directorates or departments, even though almost all the training takes place in one place and all the service delivery takes place in another place. And this amazing opportunity for junior doctors, for resident doctors, for trainee nurses, physiotherapists to be able to work in the public sector by having them fully integrated is lost, because the very nature of government is such. And I think you made another really important point of women and child development. There's another one, the Ministry of Social Justice and Empowerment that Sarbani, you referred to. I mean, mental health is so completely intersectoral. We hear this all the time, but when the very structures of governance are as fragmented right at the top, that is such a lost opportunity for efficiency and collaboration. Prabha, I'm going to come back to you later on. I want you to both, you and Sarbani, to think about this question about the coalface. What would you recommend to a psychiatrist, a psychologist, a community health worker, somebody out there in the field who has encountered an individual, like let's say a woman who is severely depressed or suicidal because she lives with a partner who is violent towards her? What can you do at the coalface? Because we also need to sometimes drill down into practical realities while we also consider these complex structural intersectional factors. Let me turn to Abhijit. Abhijit, this is going to come completely as a surprise to you, because I think this is a question that has troubled me a lot, and I want to hear your thoughts. Abhijit Nadkarni is a psychiatrist who has been associated with Sangath for a very long time, but a few years ago he got appointed as a professor at the London School of Hygiene and Tropical Medicine. But it's wonderful, Abhijit, you've continued your strong commitment to Sangath and have continued to lead the addictions research group at Sangath. Abhijit, I really wanted to ask you about the issue of substance use. We've heard something about that from Sadam, but very often conversations on mental health, actually don't acknowledge that substance use conditions, alcoholism in particular in this country, but also drug use disorders. And Sadam, thank you for touching on that. That these are also mental health conditions, and I wanted to hear your opinion, your views on the role of activism to actually get our country and our policymakers and civil society more generally to adopt a health-based model towards substance use conditions, as opposed to what we are seeing in many, many parts of the country, the rush to criminalize substance use. By this, of course, I'm not only referring to this recent episode of film stars being targeted for possessing or indeed not possessing any drugs, but I'm also talking about the tragedies that are occurring in Bihar. And this is also a complex issue because, of course, it touches on gender-based violence as well. So how do you see activism bringing these different constituencies together, but also getting our society to start doing what the rest of the world is doing, which is thinking about substance use conditions through the lens of social determinants and mental health?
Okay, Vikram, I heard you starting off by saying that this is something that your question that you have struggled quite a while. Expecting me to have an answer to that is probably asking for a bit too much, but I'll attempt to answer some of the issues that you have brought up related to substance and the lens through which we look at it. And I think this is not just an issue related to India. I think it's a global issue. And to kind of cite a very, very recent example of yesterday, actually. So me and a few colleagues from the UK and other parts of Europe are writing or wanting to write a book on alcohol and public mental health. And we put in a proposal to the publishers. It went to the reviewers, and we got feedback from one of the reviewers yesterday, which basically could not understand the framework that we're trying to apply of substance use disorders or addictions and looking at those through a mental health lens. They said your book to be either about addictions or about people with mental health problems with co-occurring substance use disorders. So the understanding of substance use problems through a mental health lens or a health lens, let alone a kind of social determinants perspectives to it, is kind of very, very far away from that anywhere in the world, including the developed world. So on that background, what can we do in India? I think what we have been trying to do all this while is push against an immovable wall. In the sense, we have been trying to change the narratives around substance use, make it less related to legal issues, make it less related to moral issues, etc. And we have failed in kind of moving that wall or a mountain. I think we need to change the kind of perspectives that we apply to addiction. So for example, some of the work that we are doing presently is looking at how addictions, or more specifically in this case, alcohol use disorder, intersects with something that people see as a problem, which is intimate partner violence. So kind of putting this through a prism of alcohol use disorders affecting the men, affecting the health, affecting their liver, etc. We kind of shifting the narrative and saying, women are affected because of intimate partner violence. Children are affected because of domestic violence happening within the family. One of the reasons for that is alcohol use disorders. What do we need to do about the intimate partner violence? We are trying to do the same around suicides as well. I mean, there are a lot of young people suicides happening in India, and that's a emotive issue. People are willing to talk about that. So one of the reasons, or one of the precursors of impulsive suicides among young men is alcohol use. So kind of turning the narrative around that and kind of focusing on emotive issues like violence, like suicide, and changing the narrative, I think is very, very important. And that's what we are trying to do. We have done enough of saying it's a issue. We need to do this because people's health is affected. I think kind of changing it to more social narratives and kind of trying to attack it, so to say, from that direction is probably going to bring it to the fore in terms of a priority for policymakers.
So I wanted to maybe just ask you how you think you might address the possible pushback you might get from people who say, and I've had that pushback. I remember I once wrote a piece on the issue of prohibition when it was announced in Bihar. I got some really strongly worded messages from gender activists saying, well, you're not a woman in Bihar, so you don't know. And it's true, I'm not, and therefore, I could not speak with that voice at all, and I was speaking with the voice that you speak with, which is a kind of a very public health approach to substance use. Isn't there a danger when you do this kind of connecting it with intimate partner violence that people might say, exactly right, that's why we should ban the damn thing and criminalize the user?
The problem, I think the response to it is what we do really well, which is research and evidence. I mean, we know from evidence that banning the substance is not going to work. It has not worked anywhere. It's not worked in places in India where we have had prohibition. I mean, people continue to drink alcohol. Intimate partner violence continues to happen, so kind of engaging with those kind of or that kind of pushback by providing evidence, I think, is probably the best way forward. Have to understand that there is no consistency in those responses as well. I mean, I don't think it's a well thought out response from all women in the country who say that we need to ban alcohol, because and this is kind of slightly on the lighter side, but just yesterday I saw a video on WhatsApp about one of local elections happening in Maharashtra, where one of a woman who is kind of who is one of the persons who is contesting the elections is actually advocating for alcohol to be given to men, and she's saying that we can put some structure around this so that the men can have little amounts of alcohol. Let's not stigmatize it. So that person comes home, drinks a little bit of alcohol, sits with the family, has food, and does not beat the wife and the children. So I think there are a lot of complexities around this, and kind of painting this under the single brush of saying that prohibition will solve all the problems is not going to work. And I think we have enough evidence to counter this assertion that prohibition is the answer to this.
Thanks, Abhijit. So you're a firm believer that science can actually change hearts and minds. Sadam, good to have you back. I wish it was that straightforward. I mean, I think you're right. Science is an important tool, but I think activism is also extremely important, and mobilizing solidarity around issues that are divisive, I think, is the fundamental challenge of our times. And I'm sure we will return back to this, hopefully, in the remainder of the session. Sadam, thanks for rejoining. I know you've been having interrupted internet issues, but it's good you came back exactly at the right time. Sadam, you already in the previous panel have spoken about many of the intersectionalities that you have had to address, coming from the Northeast, gender-based, sexuality-based discrimination, discrimination regarding substance use, but particularly you talked about being a young person and how young people, although there's so much talk about our demographic dividend, you hear this all the time, but of course the way it's talked about is that, you know, the young people in India are the largest cohort of young people in the world, and we are going to have therefore the youth economic engine. I wanted to hear from you, how do we actually take this narrative of the demographic dividend and actually convert it into a dividend of values of what young people desire from the country that they live in? How do you actually use activism to do that? And where do you see signs of success in the country right now that can be inspirational for other young people?
Thank you, Vikram sir, for the question. Yeah, can you hear me? Like, this has been interrupting, so
Yes.
yeah, okay. So similarly, like in Chennai, we also don't have current here, but it's kind of a very regular thing in Manipur, internet, current, and all these things. So it's still a big problem. So when we say about access, when we say about activism and many other things, we still you know, struggle for these basic things like electricity, basic things like internet, and people think that everyone has access to everything. We actually don't have those. So yeah, coming back to the question of you know, how young people how I also see where young people can achieve and how what's the importance of young people here is that I still am a young person, and we still do not have much of the resources. As I was repeating again and again in the last panel also, that most of the work that even if we are doing from the young person's perspective is that we are a very spirited people. We have passion, we have energy, we have so many things, but the only thing we don't have is resources. So India is a large country with a lot of young population, and if seriously we start investing in young people, the next 10 years of sustainable development goals that we are aiming of saying, leaving no one behind and achieving so many things which has been planned. The next 10 years lies in the hands of young people. So these are the people who are adolescent now, but will be achieving 35 years in the next 10 years. These are the same young people who are 30 now and will be reaching 40 years in the next 10 years. So the energy lies with these people. So we definitely need hand holding. We definitely need supervision. We definitely need a lot of learnings from the people like you and many other people here. But definitely, as a young or people who is running a group of young people's organization in a region like Northeast, which is often not visible anywhere. And I would like to ask this question again of how many panels, and which is national level, have seen young people from Northeast speaking about our issues. We don't get such opportunities very frequently. And, but from time last 2 years, I have been doing this in every panel where I get to tell people that, ignorance is no more a belief. Ignorance is just being selfish. Because it's a time when we are actually seeing that there's a lot of resources being wasted somewhere. And also, as Prabha ma'am was also saying, if she in the NIMHANS can't do so much of things, what the hell I will do as a young person organization without any backing? That is a big question. Like even with her sitting there, what will I do? I'm just sitting in a crowd-funded organization, doing a lot of work. We're trying to do a lot of work here, and also, during COVID, so there were so many slogans which were raised saying that no one is safe until everyone is safe, like leaving no one behind. But they were just good slogans. It has not reached here. No support reached here properly, and all this support which were being done, like starting up a mental health line. The state didn't have a mental health line in Manipur. They just started in the second wave. We started before that. We started providing support to young people. We started volunteering so many things and telling people that these are important issues which need to be raised. And even another example is like when COVID happened, many centers started quarantine centers for women and men. What about transgender persons? Where will they go? Where will they quarantine themselves? Manipur started the first quarantine center for transgender persons. And we were also one of those young people running behind the DC, the district commissioner, telling him, "Sir, where will transgender persons go when they come back?" Like we saw an influx of more than 60,000 people from across India coming back to Manipur, but there were no quarantine center for transgender persons or persons living with disabilities, persons living with many other health conditions. They were told to stay in hotels, paid hotels. So it was the kind of thing which we as young person had to remind every government official, we as young person had to remind other organizations that, hey, you are not being inclusive. Hey, you are not being inclusive. You are not listening to young people. But if you are listening to young people, you should definitely be more inclusive. Like how a transgender, this quarantine center was built up in one of the centers in Imphal. So they definitely need to listen to young people. But as I was again saying in the earlier panel of how young people are always seen as unaccountable, how young people are always seen as not meaningful people who can engage meaningfully. So there are a lot of questions. But one thing which we have learned is that India is said to be a young organization. Like it has a huge more than half of population are young people, and like 300 million people, they are adolescents. So it's like almost it's a very young country in one sense. So investing in young people is one thing which can bring India out of all this issue and definitely help in achieving the sustainable development goals that everyone is aiming forward to. So,
Thank you, Sadam. I think we all agree. I mean, representation is so very important. And I want to now maybe move to the second round of questions, building on some of the things we've heard about so far. This includes the question that I had flagged up earlier. How do you deal at the coalface of mental health care with issues that are clearly, I feel at times, overwhelmingly complex for the average health worker, whether it's a psychiatrist in NIMHANS or whether it's a community health worker in the village? That's one question, and I'd be happy for you all to pick any of those questions you want to address or all of them. The second is one that has been bubbling away, both in this panel and the one before it, is the issue about activism and the potential conflict that causes with institutional regulatory systems. I think we're all very aware that both within the NGO sector and also within the government sector, anything that might be seen as being potentially adversarial to the political establishment, whether it's the current one or the previous one, actually, I think this has been a long-standing issue. NGOs, for example, the moment they are politically active, they can actually lose their rights to receive funding. And Sadam, you mentioned you haven't got FCRA. The honest truth is, every NGO that has FCRA essentially has to seize any kind of political action. And in government institutions, I don't know about NIMHANS, but there are often these kinds of clauses that you have to actually not speak out against government in many government institutions. So how can you be an activist in the mental health sector other than being an individual who's not attached to an institution? So two big questions, I know, but I think these are ones that are always at least at the forefront of my mind. And so I'd love to hear your thoughts on how you might address that. Let me start with you, Sarbani.
So I would just like to attempt the first question in the way that when I am on the street, when I'm in the community, and I look at an issue, for example, that of a homeless man with mental health problems, and I know that this is a larger issue than what I am actually I am equipped to deal with at this point of time. There is one approach that we have recently taken. I mean, it is something which is very difficult for mental health workers like us, who have been very much like, in the caregiving arena for a long time. That is, we don't immediately jump in to quote unquote rescue the situation. We wait and we we send messages to relevant stakeholders. It could be the police, it could be the hospital, it could be the government, whatever, in different settings. We send messages to relevant stakeholders to come forward and take the first step, and then send them to us for referral if there is no other alternative. So this is one of the reasons we do this, is for people to become aware that they have a responsibility too. And it can't be that, we are just doing this to move the world's, the problems of the whole world. We are not here to do that. So that is something which not only is for government and stakeholders, but also for the ordinary community person. Like, they also need to understand that an NGO is not meant to be doing this. We are doing this on behalf of government also. And, that is something which the government also has to appreciate. So that taking back, Vikram, is a very, very difficult step for us, because now we know that, if the proper, it's a risk that we take. Because if we know if the proper time, the proper help does not come, it might actually make a whole difference between life and death to that person. So, so it's a calculated risk that we have to keep on taking as of now. We can use the media, we can use the police, we can use various agencies, but we have to keep on pushing. We have to keep on pushing the relevant people to take action. Unless we do that, unless we create a discomfort within systems, we will not be able to go ahead, and we will always be trying to clean up the muck which many systems are creating and leaving on the streets. So that is the approach that we have taken.
Thank you, Sarbani. Prabha, your thoughts.
So I don't want to give an impression that, I'm the lone crusader in NIMHANS and I'm the one who's doing the sort of, all of it. There are many of us who are who are sort of, activists in our thinking. And like you said, Vikram, that within the constraints of what one can do in a government system, what we can say, I think focusing a bit more on action than maybe appearing to be, adversarial in some way. But I think so. One of the things that many of us are doing are developing partnerships. For example, in the area of gender-based violence or women who are on the streets, trying to link very closely with the police. And that's something that I have found has been extremely useful to educate the police, to educate the judiciary. And the advantage that some of us in NIMHANS have is the credibility, which kind of, so even people like judges actually listen to us and, give what we say some kind of a value. So working very closely in the case of women with a lot of police women officers, training the frontline people, volunteers in women's police stations so that they become the first level of contact for a woman who's faced violence rather than a male police officer who may not be very empathic. So I think that there is a cause for optimism. I think it's important, but sometimes it's important for civil societies to also tell us what is really needed out there. And I think once we get that, many of us are willing to extend, the ability to influence policies in some way. The second thing I think is a lack of training. Like you mentioned about medical education and, health, etc. I think as psychiatrists or even as any medical professionals, we are not trained in partnerships. We are not trained, how to work with a civil society organization, with NGOs. I don't think in medical college people even know what are NGOs and who are working, and there's hardly any exposure. And the third thing is that so the lack of we are not taught how to collaborate. We are taught only how to work in silos and do specialization after specialization. And the other thing is, I think we do not have enough experience in policy and training, even as a professional. For example, we don't know how to write a policy brief, about something. How do we tell the government that? So if you expect NIMHANS to advise the government, the people in NIMHANS are not trained to do many of these things. We just learn on the job. So I think that there is, while there may be intent and while there may be a need and want, we probably don't have enough training and enough abilities to do that. So I think that to me is one of the things that we need to correct. One of the things that I suggest is to, as part of psychiatric training, as a part of the posting. And rather than yet another adult psychiatry posting looking at schizophrenia and bipolar and learning the same thing again and again, it's a good idea for them to actually get posted in a civil society organization and learn what happens, So because many of our trainees later want to actually join some of these organizations and have no clue about what they're doing. So I think that to me, to start very young, to instill some of these issues very young, to introduce these things in the training programs, in the MD, exams or training programs or whatever, to kind of make people start thinking out of the box. To me, that would be a way forward.
What a great suggestion, Prabha. It just struck me, this is such a practical way to actually bridge, at least to begin to bridge the gap, if not in our generation, but the next generation, between civil society and the institutions. It's such a terrific idea. And I hope that you're able to communicate this idea, given the position you have. I mean, to have psychiatrists in training, pediatricians, you're right, it could be any, it doesn't have to just be psychiatrists, it's just that we're in the mental health panel here. So, that's relevant to us. But imagine what this would also mean to the NGO sector, to have a guarantee that every 6 months, a bright, young, training psychiatrist will be placed in the NGO. NGOs struggle so hard to have psychologists and psychiatrists work with them. And what a mutually rewarding relationship this would be. What a terrific suggestion. That's a really, really great suggestion. I'm going to keep it in mind when I get the opportunity. But people like you with such important influential positions in government, I sincerely hope you're able to communicate this through the relevant channels. Sarbani, I see your hand up, please.
There is one thing, I mean, just taking over from Prabha, I just felt that when you were talking about training, Prabha, for civil society organizations, the kind of training that we need is first is the capacity building and strategic planning, leadership and funding, mobilization techniques and tools. That is one thing which will actually help us to, move over. I know Sangath has been doing courses in leadership in mental health for a long time now. We could stress a little on these aspects also. The second thing which civil society organizations would, we would be helped if we start organizing activities that build trust and solidarity amongst us. I mean, what is our fear of the collective? Where do we feel that, where do I feel that my identity is at stake if I join a collective? I think there is a kind of fear that my voice will not be heard anymore. And that is where I think we need to start building those small, forums where we can start discussing and talking and building trust amongst each other. The third is creating, as Prabha very rightly, she pointed out, the dialogue between institutions and civil society. With NIMHANS, like that can be one institution where we can start. And that's something we need to keep on doing, because civil society also needs to understand the institutional structures, so that there is not always a mistrust of institutions that they are going to do this. And we should not be at loggerheads with each other, because we still have the same empathy and the same vision for our own country and our people. Last but not the least, there is a need to put in place a platform that will allow sharing of knowledge and best practices. I think what happens with civil society is that we get caught up in our own, sectors, and there is no sharing of the best practices unless it's only a few of us who will be talking in different forums and we come to know of. But it's not always that it's not widespread. And if we could have that kind of a program, it would actually open up a lot more of participation amongst people, and right from the grassroots level. So these are the 4 points which Vikram, I would like to speak on behalf of the civil society. I think it would be great if you could take these forward.
Well, thank you. I mean, I know we are recording this, and I'm hoping very much the Sangath team, who are keeping track of all these suggestions, that we come out with some kind of a brief output from this. But I think these are such practical, actionable suggestions, which I'm really appreciating, rather than abstract things, about changing the whole world. No, these are things that we can do here and now, and are reasonably within our reach. I'd like to turn to a couple of questions that are in the chat, and one of them is for you and Abhijit, and one is for Sadam, and then I think we'll run out of time. Abhijit, this is a question particularly around the role of addiction researchers, and what can addiction researchers do to actually influence. You mentioned this, that's why I think these questions come up. Give us practical examples of how academics can influence activists and inform better decision making in the field of addiction. Practical examples, not just producing science, which is what you've talked about, but what do you do with that science?
So I think the practical examples also arise from that science, which is basically the case studies of what has happened across the world, and an example being America and prohibition, and what's happened in India. And taking these case examples to decision makers and trying to show them how it has not worked. I think what, besides kind of showing them how it has not worked, it's also important to highlight that the damages that it has done as well. So it's not just that it's not worked, but it has made things worse. So for example, that deaths that occur because of methanol poisoning, etc., that need to be highlighted, and for doing this, you could do this directly through advocacy with policymakers, but you can strategically use media and media influencers to put this message out there. And this message needs to come from the grassroots, because the moment it starts to come from academics or people who are seen as privileged who get affected by prohibition, then people do not take these messages very seriously. And I kind of come round to the same thing. I mean, the science has the answers. It's how we put out those messages to the policymakers. And if I may have your permission, Vikram, for a minute, if I may just address the issue about the coal face and what to do about that. From my personal experience of having moved from being a psychiatrist trained in India, who used to think that the answer to everyone's problem is the prescription that I give and the pills that I prescribe to people. And moving on from that through my training in the UK and then coming back to India and interacting with other enlightened people from the civil society, other perspectives around social determinants, I think what I've realized is the biggest gap, and which Prabha also alluded to, is the training systems. When I speak to young psychiatrists in training here, I realize that they have absolutely no clue what's happening outside of their ivory towers, where they are just trained to write the prescription and to make people feel good. And as long as we have psychiatrists who are getting churned out, who believe that their responsibility is only to write people pills which will make them happy, without acknowledging the other social determinants leading to mental health problems, I think we have a big problem on our hands.
Well, thank you. You know, those are powerful words, and I want to end, Sadam, with the subject of social determinants. This is another question. You are a civil society activist representing many different sectors, and these are the intersections of many forms of vulnerability. What do you recommend to people like Prabha, me, and Abhijit as the key research questions that if we tomorrow have to start working to address these social determinants that you described of minority groups and so on? What do you think are the key questions that we should be trying to tackle?
I'll start with an example of when I went to the Manipur State AIDS Control Society that heads the HIV program, to the person who's taking charge. I went and I told him, sir, I'm a queer man, I'm a gay man, I'm a man who has sex with men. What are the support that is available? He told me, you don't look like one. So he was ignorant. He didn't know. He had his own stereotypes of how queer people look, how transgender persons should look like, how people living with mental health conditions should look like. So they had their own pre-assumed ideas of how are the people of different populations should live and should behave and should express themselves. When I went to take the services, that was his answer, that you don't look like one. Then what should I tell him? I sat down and I started talking about different gender sexualities and everything. So the thing is, the one thing which I request to everyone is that acknowledge the diversity. If we don't know anything, it's always okay to listen to young people also. As I have been mentioning this, that elder people, experienced people have a lot to learn from young people also, in spite of our less experiences, but also because mostly, sorry, there's some background noise coming in. So that was the thing. And I would just like to add one thing here also, that when, as a young person, is it bothering a lot? Just one,
It's not bothering us at all.
Yeah. So when I say I am running a support group, or when I say I'm running an organization, the first impression that comes in people's mind is that Sadam must be earning a lot. The way how NGO are looked by different government organizations and stakeholder is that we are earning money using people as beneficiaries and churning out a lot of money out of that. So the first impression of NGO is very bad in Manipur, and I know it must be similar across other places also. So that is one impression which needs to change. And also the way of collective is like how Sarbani ma'am was also saying, like there is a need of collective. But if we see, there are so many youth collectives which were formed, but during the last 2 years of COVID, many collapsed. But who checks them that how many young people's organizations are still functioning? We don't, because as a funding organization or as an organization which is providing support in forms of capacity building, training, or advocacy, or research in many forms, the one thing is that young people, when they collapse, nobody asks them about their well-being, of are you functioning well or not. If a young organization collapses, it means collapse. We are not coming back again. there might be another organization which might come up. Like if we see the range of organizations that is working in India, if you see the number of these organizations working in India, you can only point out 5 or 6 organizations which are working really well. But most of the younger ones have died. Like how we lost our workspace and how we are struggling to survive. Should we look into striving ourselves for the organization or the people that we work with? This is a real struggle. So we definitely need to learn a lot from people like Sarbani ma'am, Prabha ma'am, and Abhijit sir also. But the first thing is to listen to young people. Include young people in the program, listen to them while planning, listen to them in decision making, include them in panels, and they have a different experience which you can also get a lot from. So that's it.
Is it my internet that's frozen? Hi, sorry, I thought my internet frozen for a moment. It had. Yeah, you can see Sadam, Goa has pretty lousy internet too, so you're not the only one. But I just want to say a great way to end this panel. I think the message that you have left us with, listen to people. This is not just about young people. All the young people are the constituents you represent. Listen to the people who supposedly are your beneficiaries of research. This is how you will find the right research questions that directly address their felt needs and lived experience. Thank you all so much, Prabha, Sarbani, Abhijit, and Sadam. What a terrific panel this has been. I've really enjoyed myself. Thank you for your frank and free conversation. Take good care, and I'm going to hand over now to the next moderator. Bye-bye.